AI for the Mind, Revolutionizing Mental Health Care, explores the critical role of artificial intelligence in addressing the escalating challenges of mental health care. The book is a vital resource for healthcare professionals, technology enthusiasts, policymakers, and anyone interested in the intersection of AI and mental health services. It provides an insightful examination into how AI technologies such as machine learning, natural language processing, and robotics are currently transforming mental health practices. The first part of the book offers a detailed overview of global mental health disorders and the barriers to effective treatment. It introduces readers to various AI-driven tools like diagnostic algorithms, chatbots for personalized therapy sessions, and advanced data analysis techniques that enhance treatment outcomes. The second part presents case studies and expert interviews that showcase both successes and challenges in applying AI to therapy settings. Notable applications discussed include virtual reality exposure therapy, VRET, for PTSD and predictive analytics for preventing depression relapses. The concluding section speculates on future innovations in AI that could further revolutionize mental health care while emphasizing the importance of ethical considerations. It calls for continued dialogue among stakeholders to ensure these advancements genuinely benefit those with mental illnesses without infringing on personal integrity or autonomy. Overall, this book provides a comprehensive look at how AI can improve mental health services globally, while also highlighting potential limitations and ethical concerns. The rise of mental health challenges and AI solutions. The escalating prevalence of mental health disorders worldwide presents a formidable challenge to global health systems. Recent studies indicate that 1 in 4 individuals will experience a mental health issue at some point in their lives, underscoring the urgent need for effective solutions. This widespread impact affects not only personal well-being but also places significant strains on economies and social structures globally. Mental health disorders encompass a wide range of conditions, from common disorders such as depression and anxiety to more severe forms like schizophrenia and bipolar disorder. Depression alone is identified by the World Health Organization as a leading cause of disability worldwide, affecting over 264 million people. Anxiety disorders also contribute substantially to the global burden, with estimates suggesting around 284 million individuals are affected. The distribution of these disorders varies significantly across different regions and demographics, influenced by factors such as socioeconomic status, access to healthcare, cultural attitudes towards mental health, and environmental stressors. For instance, high-income countries report higher rates of diagnosed mental health conditions, possibly due to better diagnostic practices and greater awareness. Conversely, in low-income countries, underdiagnosis and underreporting are prevalent due to limited access to care and stigma associated with mental illnesses. Children and adolescents represent a particularly vulnerable demographic. Globally, it is estimated that up to 20% of children and adolescents suffer from debilitating mental health conditions. These early-onset conditions can have profound implications for educational attainment, employment prospects, and overall life trajectories if not addressed promptly. The rising trend in mental health issues calls for innovative interventions that can transcend traditional barriers to treatment such as stigma, cost, and accessibility. In this context, artificial intelligence, AI, emerges as a promising tool capable of revolutionizing the approach towards diagnosis, treatment personalization, and management of mental health disorders. By leveraging AI-driven analytics and interventions, there is potential not only for enhanced diagnostic accuracy, but also for providing scalable solutions that could reach populations underserved by traditional healthcare systems. In conclusion, understanding the global prevalence of mental health disorders is crucial for developing targeted strategies that address the specific needs of diverse populations affected by these conditions. As we advance technologically with tools like AI at our disposal, there lies an opportunity to make significant strides in combating the mental health crisis on a global scale. 1.2 Barriers to effective mental health treatment. The journey towards effective mental health treatment is fraught with numerous obstacles that hinder the accessibility and quality of care for those in need. These barriers are multifaceted, ranging from societal stigmas to systemic deficiencies within healthcare infrastructures. One of the most significant impediments is the pervasive stigma associated with mental illness. Cultural perceptions and prejudices often portray mental health issues as signs of weakness or moral failings, discouraging individuals from seeking help. This stigma is not only prevalent in social contexts but can also be observed within families and workplaces, further isolating those affected and delaying their access to necessary treatment. Economic barriers also play a critical role in limiting access to mental health services. High costs of therapy, medication, and other essential services make it difficult for low-income individuals to afford treatment. Insurance coverage for mental health is often inadequate, offering limited support compared to physical health ailments. This economic strain is exacerbated in regions where public health funding fails to prioritize mental health adequately, leaving essential services underfunded or unavailable. Geographical disparities further complicate the accessibility of mental health care. Individuals living in rural or remote areas often face significant challenges due to the scarcity of mental health professionals and facilities in these regions. The lack of local services forces patients to travel long distances for treatment, adding logistical difficulties and additional costs that may deter consistent care. In addition to these barriers, there exists a substantial gap in professional training and resources dedicated to mental health. Many healthcare providers receive minimal training in this field, affecting their ability to diagnose and treat mental disorders effectively. This shortage of specialized professionals not only diminishes the quality of care, but also increases wait times for patients seeking help. Finally, technological limitations can also restrict effective treatment delivery. Although telemedicine has emerged as a promising solution by providing remote access to psychological services, not all populations have the necessary technology or internet connectivity required for such interventions. Addressing these barriers requires a concerted effort from governments, healthcare providers, communities, and individuals alike. By fostering greater awareness, increasing funding for mental health services, improving insurance coverage, expanding professional training programs, and enhancing technological infrastructure, more people can gain access to the vital care they need. 1.3 Introduction to AI Technologies in Mental Health Care. The integration of artificial intelligence, AI, technologies into mental health care represents a transformative shift towards more accessible, personalized, and efficient treatment options. AI's potential to address the multifaceted barriers outlined in previous discussions is significant, offering innovative solutions that could reshape the landscape of mental health services. AI technologies in mental health primarily focus on early detection, diagnosis, treatment, and management of mental illnesses. Machine learning models, a subset of AI, are particularly adept at analyzing vast datasets quickly and with high accuracy. These models can identify patterns that may not be immediately apparent to human clinicians. For instance, natural language processing, NLP, tools analyze speech and written words to detect subtle signs of mental distress or changes in mood and cognitive function over time. Another critical application is the development of chatbots and virtual agents that provide immediate support through conversational interfaces. These AI-driven tools are designed to offer initial counseling, guide users through therapeutic exercises, or help them manage crises until professional help is available. Notably, such applications are crucial for individuals who face geographical or economic barriers that limit their access to traditional healthcare services. Furthermore, predictive analytics in AI can enhance the personalization of treatment plans. By integrating data from various sources, such as medical records, wearable device outputs, and patient self-reports, AI systems can help clinicians predict which treatments will be most effective for specific patients based on similar cases seen historically. Despite these advancements, the deployment of AI in mental health care must be approached with caution to address potential ethical concerns such as privacy issues, data security, and the need for transparent algorithms that do not perpetuate existing biases. Moreover, there is an ongoing debate about the extent to which AI should play a role in patient interaction without losing the essential human touch required in therapy. In conclusion, while AI technologies promise significant improvements in mental health care by breaking down some of the barriers discussed earlier, such as accessibility and personalized treatment, their integration needs careful consideration regarding ethical implications and maintaining a balance between technological assistance and human empathy. References: Davenport, T. and Calicotta, R. 2019. The potential for artificial intelligence in healthcare. Future Healthcare Journal, 6, 2, 94-98. Luxton, D. 2020. Artificial Intelligence in Behavioral and Mental Health Care. Academic Press. Vadium, A. N. Wisniewski, H. Halamka, J. D. Kashavan, M. S. and Torres, J. B. 2019. Chatbots and Conversational Agents in Mental Health. A Review of the Psychiatric Landscape. Canadian Journal of Psychiatry, 64, 7, 456-464. Minor, A.S., Laranja, L. and Kakabali, A.B., 2020. Chatbots in the Fight Against the COVID-19 Pandemic. NPJ Digital Medicine, 3, 1, 65. 2. Integration of AI into current mental health practices. The integration of artificial intelligence, AI, into the diagnostic processes of mental health represents a significant advancement in identifying and understanding mental disorders more efficiently. AI-driven diagnostic tools leverage complex algorithms to analyze vast amounts of data, including speech patterns, facial expressions, and behavioral data, which can often reveal subtleties in mental health states that are typically imperceptible to humans. One of the primary advantages of AI in diagnostics is its ability to provide rapid assessments. Traditional diagnostic procedures can be time-consuming, often requiring multiple sessions over weeks or months before a reliable diagnosis is made. AI tools, however, can process data from patient interactions instantaneously, offering preliminary diagnoses that can help accelerate the treatment process. For instance, machine learning models have been developed to analyze verbal cues and speech patterns to detect symptoms of depression or anxiety disorders effectively. Moreover, these tools enhance the accuracy of diagnoses by minimizing human biases that might affect decision-making processes. By relying on standardized data analysis protocols, AI systems ensure consistency in how patient information is interpreted and used in clinical settings. This objectivity is crucial for maintaining high standards of care across different healthcare providers and patient demographics. Another transformative aspect of AI-driven diagnostic tools is their scalability. With these technologies, mental health services can reach a broader audience, including populations in remote or underserved regions who traditionally suffer from lack of access to mental health professionals. Telepsychiatry combined with AI diagnostics can bridge this gap by providing reliable mental health assessments through online platforms. Despite these benefits, the deployment of AI in mental health diagnostics also raises ethical concerns regarding privacy and data security. Patient data used for training AI systems must be handled with strict confidentiality and compliance with medical regulations like HIPAA, Health Insurance Portability and Accountability Act, in the United States. Furthermore, there remains an ongoing debate about the extent to which healthcare should rely on automated systems versus human judgment. In conclusion, while AI-driven diagnostic tools offer promising enhancements to mental health practices through improved speed, accuracy, and accessibility of diagnostics, careful consideration must be given to ethical implications and the balance between human and machine involvement in patient care. 2.2 Personalized therapy sessions via chatbots. The advent of AI in mental health not only revolutionizes diagnostics but also extends its capabilities to therapeutic interventions, particularly through personalized therapy sessions facilitated by chatbots. These AI-driven chatbots are designed to simulate conversation and provide psychological support, making mental health care more accessible and tailored to individual needs. Chatbots in therapy use natural language processing, NLP, to interpret the user's messages and respond with appropriate therapeutic interventions. This technology allows for a level of personalization previously unattainable in traditional therapy settings. For instance, based on the analysis of text inputs from users, chatbots can identify mood patterns and offer customized coping strategies that align with the user's specific emotional states and preferences. Moreover, these AI systems are available around the clock, providing immediate support without the constraints of scheduling appointments or the availability of human therapists. This feature is particularly beneficial for individuals who might experience anxiety or stress during off hours, or those who reside in areas with limited access to mental health professionals. Another significant advantage is the anonymity that chatbots offer. Many individuals may feel stigmatized or uncomfortable discussing their mental health issues face-to-face with a therapist. Interacting with a chatbot can eliminate this barrier, encouraging more people to seek help early before their conditions escalate. However, while chatbots represent a promising tool in mental health therapy, they are not without challenges. The quality of interaction can vary significantly depending on the sophistication of the AI model used. Additionally, there are concerns about privacy and data security, as sensitive information shared during sessions needs stringent protection measures. In conclusion, personalized therapy sessions via chatbots hold great potential for enhancing mental health treatment by providing scalable, immediate, and tailored support. As these technologies continue to evolve and improve in accuracy and responsiveness, they could become an integral part of global mental health strategies. Nevertheless, it remains crucial to address ethical considerations and ensure robust privacy protections are in place. 2.3 AI Enhanced Data Analysis for Treatment Outcomes. The integration of artificial intelligence, AI, into the analysis of treatment outcomes in mental health represents a transformative shift towards more data-driven and precise care strategies. By leveraging sophisticated algorithms, mental health professionals can now harness vast amounts of data to improve treatment efficacy and tailor interventions to individual needs. AI-enhanced data analysis involves the systematic use of machine learning techniques to identify patterns and correlations in treatment responses that are not immediately apparent through traditional methods. For instance, AI can analyze text from therapy sessions, patient feedback, and even passive data from mobile devices to assess the effectiveness of specific therapeutic approaches for different demographics or psychological conditions. This technology enables clinicians to predict which treatments are most likely to succeed for a particular patient based on historical data. Such predictive analytics not only streamline the therapeutic process but also reduce the trial and error period significantly, leading to faster recovery times and decreased healthcare costs. Moreover, continuous monitoring through AI tools can provide real-time insights into patient progress, allowing for timely adjustments in treatment plans. Furthermore, AI's capability to handle large datasets extends beyond individual care. On a broader scale, it facilitates large-scale outcome studies across diverse populations and geographic locations. This is particularly valuable in identifying effective interventions for under-researched or marginalized groups who may not have previously been adequately represented in mental health research. Despite these advantages, the implementation of AI in analyzing treatment outcomes must be approached with caution regarding privacy concerns and ethical considerations. Ensuring the security of sensitive patient data and interpreting AI-generated insights with an understanding of their limitations is crucial to maintaining trust and integrity in mental health practices. In conclusion, while AI-enhanced data analysis holds significant promise for revolutionizing mental health treatments by providing deeper insights and personalized care options, it necessitates careful consideration of ethical standards and robust safeguards to protect patient information. References: Davenport, T. and Calicotta, R. 2019. The Potential for Artificial Intelligence in Healthcare. Future Healthcare Journal, 6, 2, 94-98. Luxton, D. 2020. Artificial Intelligence in Behavioral and Mental Health Care. Academic Press. Vadium, A. N. Wisniewski, H. Halamka, J. D. Kashavan, M. S. and Torres, J. B. 2019. Chatbots and Conversational Agents in Mental Health. A Review of the Psychiatric Landscape. Canadian Journal of Psychiatry, 64, 7, 456-464. Minor, A.S., Laranja, L. and Kakabali, A.B., 2020. Chatbots in the Fight Against the COVID-19 Pandemic. NPJ Digital Medicine, 3, 1, 65. 3 case studies and expert insights on AI in therapy. Virtual reality exposure therapy, VRET, has emerged as a groundbreaking approach in the treatment of post-traumatic stress disorder, PTSD. leveraging the capabilities of immersive technology to facilitate therapeutic outcomes. This method involves the use of virtual environments that simulate situations related to the traumatic events experienced by patients, allowing them to confront and process these memories in a controlled and safe setting. The efficacy of VRET in treating PTSD is supported by its ability to create highly realistic scenarios that can be precisely tailored to each individual's experiences. Therapists can adjust the intensity of the simulations, ensuring that exposure does not overwhelm the patient, but is sufficient to engage with their trauma effectively. This personalized adjustment helps in gradually desensitizing individuals to their triggers, reducing symptoms over time. One significant advantage of VRET is its capacity to provide therapy in cases where real-life exposure is either impractical or re-traumatizing. For instance, veterans who have experienced combat scenarios can revisit similar environments virtually without the physical risks associated with actual combat zones. This method not only ensures safety but also enhances accessibility for those who might otherwise avoid traditional therapeutic approaches due to fear of direct confrontation with traumatic stimuli. Research into VRET has shown promising results, with many patients reporting decreased PTSD symptoms following treatment. Studies highlight improvements in areas such as anxiety reduction and increased ability to cope with daily activities without being hindered by past trauma. Moreover, VRE therapy sessions are often shorter in duration compared to traditional methods, which can lead to quicker progress and potentially lower treatment costs. Despite its benefits, VRET's integration into mainstream mental health care requires consideration of several factors including technological accessibility, therapist training on VR equipment and software, and patient readiness and comfort with using such immersive tools. Furthermore, ethical considerations must be addressed regarding data privacy and the psychological impact of intense virtual experiences. In conclusion, while virtual reality exposure therapy presents a novel avenue for effectively managing PTSD symptoms through controlled exposure and personalized treatment plans, ongoing research and development are crucial for optimizing its application and broadening its reach within mental health services. 3.2 Predictive analytics in preventing depression relapses. Predictive analytics has become a pivotal tool in the realm of mental health, particularly in the prevention of depression relapses. By harnessing vast amounts of data and advanced algorithms, this approach enables clinicians to identify at-risk individuals and intervene before a relapse occurs. The integration of predictive analytics into therapeutic settings is transforming how mental health professionals manage and treat depression. The core of predictive analytics lies in its ability to analyze historical data from patients who have previously experienced episodes of depression. This data includes various biomarkers, treatment histories, patient responses to different therapies, and even real-time data from mobile health applications. By applying machine learning techniques to these datasets, predictive models can forecast the likelihood of a patient's relapse with significant accuracy. One innovative application involves monitoring social media usage patterns and changes in communication behavior, which are often early indicators of mood fluctuations. Algorithms that detect these subtle changes can alert healthcare providers about a potential deterioration in the patient's mental state. Similarly, wearable technology that monitors physiological data such as sleep patterns and activity levels offers another layer of predictive capability, flagging anomalies that could precede a depressive episode. Despite its potential, the implementation of predictive analytics in clinical practice must be handled with sensitivity to privacy concerns and ethical considerations. The accuracy of predictions depends heavily on the quality and breadth of data available. Thus, there is an ongoing need for robust data governance frameworks to ensure patient confidentiality is maintained. Moreover, while predictive analytics can indicate a probability of relapse, it does not replace traditional therapeutic methods, but rather enhances them by providing clinicians with powerful tools for personalized care planning. It allows for tailored intervention strategies that are proactive rather than reactive, potentially reducing hospital readmissions and improving overall treatment outcomes for depression. In conclusion, as predictive analytics continues to evolve, its integration into mental health practices promises not only to enhance the efficacy of treatments, but also to revolutionize the preventive strategies employed against depression relapses. Ongoing research and collaboration between technologists and clinicians will be key to realizing the full potential of this technology in clinical settings. 3.3 Challenges and Setbacks in AI Implementation. The integration of artificial intelligence, AI, into therapeutic practices, while promising, is fraught with numerous challenges and setbacks that can impede its effectiveness and acceptance. One of the primary hurdles is the ethical concern surrounding data privacy. The use of AI in therapy involves collecting sensitive personal information, which raises significant concerns about data protection and patient confidentiality. Another significant challenge is the accuracy and reliability of AI predictions. While AI systems can process vast amounts of data to identify patterns that may not be evident to humans, they are only as good as the data they are trained on. Biases in training data can lead to skewed or unfair outcomes, potentially harming patients rather than helping them. For instance, if an AI system is predominantly trained on data from a particular demographic, its applicability and accuracy for other demographics may be limited. Moreover, there is a lack of transparency in how many AI systems make decisions, often referred to as the black box problem. This opacity can undermine trust among clinicians and patients, who may be reluctant to rely on or adhere to guidance from an unexplainable algorithmic source. The integration of AI tools into existing healthcare infrastructures also presents logistical challenges. Many healthcare providers lack the technical expertise necessary to implement and manage sophisticated AI systems effectively. Additionally, these systems often require significant upfront investment in terms of both time and money, which can be a barrier for smaller practices or institutions in resource-limited settings. Furthermore, regulatory challenges cannot be overlooked. The healthcare sector is heavily regulated to ensure patient safety and care standards. Current regulations may not adequately address the unique aspects of AI applications in therapy, leading to potential legal issues or delays in approval processes for new AI tools. In conclusion, while AI holds considerable potential to transform therapeutic practices through enhanced predictive analytics and personalized treatment plans, several substantial challenges need addressing. Overcoming these obstacles requires concerted efforts from technologists, clinicians, regulators, and ethicists to ensure that AI implementation in therapy is both effective and ethically sound. References: Char, D. S. Shah, N. H. and Magnus, D. 2018. Implementing Machine Learning in Healthcare, Addressing Ethical Challenges. The New England Journal of Medicine. Obermeyer, Z. and Emmanuel E. J. 2016. Predicting the Future Big Data, Machine Learning and Clinical Medicine. The New England Journal of Medicine. Goodman, K. W. and Vaina, E. 2016. Challenges in Ethics, Safety, Best Practices, and Oversight Regarding AI in Healthcare. Considerations and Recommendations. Future of Privacy Forum. Jiang F. Jiang Y. Zhi H. Dong Y. Li H. Ma S. Wang Y. Dong Q. Shin H. Wang Y. 2017. Artificial Intelligence in Healthcare, Past, Present, and Future. Stroke and Vascular Neurology. Price 2W.N. 2020. Artificial Intelligence in Healthcare, Anticipating Challenges for a New Era of Treatment. Harvard Business Review. For ethical considerations in AI-enabled mental health care in the dynamic intersection of artificial intelligence, AI, and mental health care, the challenge of balancing technological innovation with patient privacy emerges as a critical concern. As AI technologies like machine learning and natural language processing begin to play pivotal roles in diagnosing and treating mental health conditions, they also raise significant privacy issues that must be addressed to maintain trust and efficacy in healthcare. The integration of AI into mental health services offers substantial benefits, such as enhanced diagnostic accuracy, personalized treatment plans, and more efficient patient monitoring. However, these advancements necessitate the collection, analysis, and storage of large volumes of sensitive personal data. The risk of breaches and unauthorized access to such data can lead to severe consequences for individuals' privacy and overall well-being. To navigate these challenges effectively, it is essential for stakeholders in the AI mental health nexus to implement robust data protection measures. This includes employing advanced encryption methods for data at rest and in transit, ensuring that only authorized personnel have access to sensitive information, and regularly updating security protocols to guard against emerging cyber threats. Moreover, transparency plays a crucial role in maintaining patient trust. Healthcare providers must clearly communicate how patient data is used, who has access to it, and what measures are in place to protect it. Patients should be empowered with the ability to opt in or opt out of data sharing schemes based on their comfort levels without compromising the quality of care they receive. Regulatory frameworks also need to keep pace with technological advancements. Legislation such as the General Data Protection Regulation, GDPR, provides a strong foundation, but continuous updates are necessary to address specific nuances related to AI applications in mental health. Collaboration between legal experts, technologists, healthcare providers, and patients is vital to develop guidelines that balance innovation with ethical considerations. In conclusion, while AI presents transformative opportunities for mental health care improvement, ensuring privacy must remain a top priority. By implementing stringent security measures, maintaining transparency with patients about their data use, and adapting regulatory frameworks accordingly, stakeholders can safeguard personal integrity while fostering innovative solutions that enhance mental health outcomes. For point 2, ensuring autonomy and personal integrity, the integration of AI into mental health care, while offering significant benefits, also presents unique challenges to patient autonomy and personal integrity. Autonomy in healthcare is fundamentally about allowing patients to make informed decisions regarding their treatment options. In the context of AI-enabled mental health services, this means ensuring that patients retain control over their own treatment processes, even when AI systems provide recommendations or insights. One of the primary concerns is the potential for AI systems to influence or override the patient's own choices or the clinical judgments of human therapists. To address this, it is crucial that AI applications are designed to support decision-making rather than replace it. This can be achieved by developing systems that provide transparent explanations for their recommendations, thereby enabling patients and clinicians to understand the basis of AI-generated advice and consider it within the broader context of personal or clinical needs. Moreover, maintaining personal integrity involves protecting not only the privacy but also the psychological well-being of individuals. AI systems should be designed to detect and adapt to a patient's emotional state and vulnerabilities with sensitivity. For instance, an AI tool used in therapy sessions must be capable of recognizing signs of distress or discomfort triggered by certain topics or questions, adjusting its interactions accordingly to avoid harm. In addition to technical safeguards like encryption and access controls as discussed in previous sections on data protection, ethical guidelines specific to autonomy must be rigorously developed and implemented. These guidelines should ensure that AI tools do not exploit patients' psychological vulnerabilities or coerce them into decisions they would not have made independently. Furthermore, regulatory bodies need to play a proactive role in overseeing how these technologies are applied within therapeutic settings. Regular audits and assessments should be conducted to ensure compliance with ethical standards designed to protect patient autonomy and integrity. Engaging ethicists and representatives from patient advocacy groups in creating these regulations can help align technological advancements with societal values and individual rights. In conclusion, while leveraging AI in mental health care has transformative potential, it necessitates a careful balance between benefiting from technological capabilities and upholding fundamental ethical principles such as autonomy and personal integrity. By implementing comprehensive strategies that prioritize these values, stakeholders can foster an environment where technology enhances mental health care without compromising individual rights. For point 3, addressing bias and fairness in AI applications, the deployment of AI in mental health care necessitates a rigorous examination of bias and fairness, as these technologies can significantly influence diagnostic and therapeutic outcomes. Bias in AI can arise from various sources, primarily through the data on which models are trained. If the training data is not representative of the diverse patient population, the AI system may exhibit biased decision-making, potentially leading to inadequate or harmful treatment recommendations for underrepresented groups. To mitigate these risks, it is essential to implement strategies that ensure the fairness of AI applications. One effective approach is to utilize diverse datasets that reflect the demographic composition of all potential users. This involves not only ethnic and racial diversity, but also considerations related to age, gender, socioeconomic status, and more. Furthermore, continuous monitoring and updating of AI systems are crucial as they can evolve based on new data inputs and changing societal norms. Another critical aspect is the development of algorithms that are transparent and interpretable. Stakeholders should be able to understand how decisions are made by AI systems. This transparency enables clinicians and patients to trust AI recommendations and fosters a collaborative environment where AI tools are used as aids rather than replacements for human judgment. Ethical guidelines specifically tailored to address bias in AI mental health applications must also be established. These guidelines should dictate how datasets are constructed, mandate regular assessment of algorithmic fairness, and ensure that any biases detected are corrected promptly. Involving ethicists and representatives from diverse communities in creating these guidelines can provide multiple perspectives that enhance the robustness of ethical standards. Regulatory oversight plays a pivotal role in maintaining fairness in AI applications within mental health care. Governments and international bodies should enforce standards that require developers to demonstrate their adherence to ethical practices concerning bias mitigation before their solutions can be deployed in clinical settings. In conclusion, addressing bias and ensuring fairness in AI-enabled mental health care not only improves treatment outcomes, but also upholds the dignity and rights of all individuals seeking help. By implementing comprehensive strategies focused on diversity, transparency, ethical governance, and regulatory compliance, stakeholders can leverage AI's benefits while minimizing its potential harms. References: Bulamwini, J., and Gebru, T. 2018. Gender Shades, Intersectional Accuracy Disparities in Commercial Gender Classification. Proceedings of Machine Learning Research. Raji, I. D. and Bulamwini, J. 2019. Actionable Auditing. Investigating the impact of publicly naming biased performance results of commercial AI products. ICE, Obermeyer, Z. Powers, B. Vajali, C. and Mulanathan, S. 2019. Dissecting Racial Bias in an Algorithm Used to Manage the Health of Populations. Science. Goodman, B. and Flaxman, S. 2017. European Union Regulations on Algorithmic Decision-Making and a Right to Explanation. AI Magazine. Dworkin, J. Hesselink, A. Glansberg-Cranen, E. and Fisk, A. 2020. Ethics Guidelines for Trustworthy AI. Future of Life Institute. 5 Future Innovations and Potential Impacts on Healthcare. The relentless rise in mental health issues globally necessitates not only innovative solutions, but also rapid advancements in technology to address these challenges effectively. The integration of artificial intelligence, AI, into mental health care, as explored in AI for the Mind, Revolutionizing Mental Health Care, is poised to transform the landscape significantly. This section delves deeper into the specific upcoming technological advancements that could revolutionize how mental health services are provided. One of the most promising areas of AI application is in the development of advanced diagnostic tools that utilize machine learning algorithms to detect mental health conditions at an early stage. These tools can analyze vast amounts of data from various sources, including genetic information, patient medical histories, and even social media usage patterns, to identify potential mental health issues before they become severe. This proactive approach could dramatically improve outcomes for patients by enabling earlier intervention. Another significant advancement is the enhancement of personalized therapy using AI-driven chatbots and virtual reality, VR. These technologies offer new ways for patients to engage in therapy sessions that are tailored specifically to their individual needs and preferences. For instance, VR can be used to simulate environments or situations that help patients face their fears or practice coping strategies in a controlled setting. Similarly, AI-powered chatbots can provide 24/7 support and deliver cognitive behavioral therapy techniques to help manage symptoms like anxiety or depression. Furthermore, AI is being leveraged to improve the accuracy and efficiency of treatment through predictive analytics. By analyzing patterns and data collected over time from a wide range of sources, AI systems can predict when a patient might experience a relapse or worsening of their condition and suggest preventive measures or adjustments to their treatment plan accordingly. In addition to these technological advancements, there is also significant progress being made in the use of natural language processing, NLP, technologies to analyze speech and text for signs of mental distress. This can be particularly useful in teletherapy sessions where therapists may not always be able to pick up on nonverbal cues that indicate emotional states. As these technologies continue to evolve, it is crucial that ethical considerations are prioritized to protect patient privacy and ensure that AI systems do not perpetuate existing biases or inequalities within healthcare systems. The ongoing dialogue among stakeholders, including healthcare professionals, technology developers, policymakers, and patients, is essential for guiding these advancements towards beneficial outcomes for all individuals struggling with mental health issues. 5.2 Scalability of AI solutions across different regions. The expansion of artificial intelligence, AI, in healthcare, particularly in mental health services, presents a transformative opportunity for global health systems. However, the scalability of these AI solutions across different regions is crucial to their success and impact. This section explores the challenges and strategies involved in scaling AI technologies in diverse healthcare environments. One primary challenge in scaling AI solutions is the variability in healthcare infrastructure across regions. Developed countries often have advanced technological frameworks and more resources to implement sophisticated AI systems. In contrast, developing regions may struggle with basic healthcare needs, making high-tech solutions less feasible. For instance, an AI system designed to analyze genetic data for mental health predictions requires not only advanced technology, but also trained personnel to operate such systems and interpret results effectively. To address these disparities, it is essential to develop adaptable AI models that can provide value regardless of regional technological capabilities. For example, simpler diagnostic tools based on widely available mobile technology can be deployed in low-resource settings. These tools can perform basic assessments or track symptoms using simple algorithms that do not require extensive computational power. Another significant aspect of scalability involves cultural and linguistic adaptation. Mental health diagnoses and treatments are deeply influenced by cultural contexts. Thus, AI systems must be sensitive to these nuances to be effective globally. Implementing natural language processing, NLP, techniques that understand local dialects and cultural idioms can help make AI-driven therapy more accessible and relevant across different regions. Furthermore, regulatory variations pose a substantial challenge to the international scalability of AI solutions in healthcare. Each country has its own set of regulations governing medical data usage, patient privacy, and cross-border data flows. Developers of AI applications must navigate this complex regulatory landscape to deploy their solutions legally and ethically across jurisdictions. In conclusion, while the potential of AI to revolutionize mental health care on a global scale is immense, achieving this requires overcoming significant challenges related to infrastructure disparities, cultural differences, and regulatory environments. Collaborative efforts among tech developers, healthcare providers, policymakers, and community leaders are essential to tailor AI solutions that are both effective at scale and sensitive to regional needs. 5.3 Fostering collaborative efforts among stakeholders. The successful implementation of AI in healthcare, particularly in mental health services across diverse regions, necessitates robust collaborative efforts among various stakeholders. This section delves into the dynamics and strategies of fostering such collaborations to enhance the scalability and effectiveness of AI solutions globally. Collaboration in healthcare innovation is not merely beneficial but essential. Diverse stakeholders, including technology developers, healthcare providers, policymakers, and community leaders, must work together to ensure that AI solutions are adaptable and culturally relevant. For instance, tech developers can create flexible AI systems that can be customized for local needs with inputs from local healthcare workers who understand the unique challenges of their communities. One effective strategy for fostering collaboration is through the establishment of interdisciplinary teams that bring together experts from various fields such as AI technology, clinical psychology, data security, and ethical governance. These teams can address complex issues such as data privacy concerns or ethical dilemmas that may arise when implementing AI in mental health diagnostics and treatment. Moreover, engaging with local communities through participatory design processes can ensure that the end user's needs and preferences are incorporated from the outset. This approach not only enhances the usability of AI solutions, but also builds trust among users, which is crucial for the adoption of new technologies. Another critical aspect involves navigating regulatory environments which vary significantly across different regions. Collaborative efforts must therefore also include legal experts who can help align technological innovations with national and international regulations to facilitate smooth deployment across borders. In conclusion, fostering collaborative efforts among stakeholders is pivotal for scaling AI solutions in healthcare effectively. It requires a concerted effort to bridge gaps between technology and practical application while considering cultural sensitivities and regulatory requirements. Such collaborations can lead to more sustainable health interventions that are both technologically advanced and deeply integrated into the fabric of local healthcare systems. References: Anderson, J., and Rainey, L. 2018. Artificial Intelligence and the Future of Humans. Pew Research Center. Baumel, A., Kane, J.M., and Chan, S. 2020. Digital Engagement Strategies for Mental Health Care Delivery. Journal of Medical Internet Research. Gates, B. 2019. How AI Can Be a Force for Good in Healthcare. Gates Notes. Kumar R. and Bhaskaran, H. 2021. Ethical Implications of AI in Healthcare. A Review. Ethics and Information Technology. Zhou, L. Pan, S. Wang, J. and Vasilikis, A.V. 2017. Machine Learning on Big Data. Opportunities and Challenges. Neurocomputing. 6 Conclusion and Forward-Looking Perspectives: The Transformative Impact of Artificial Intelligence, AI, on mental health care is profound and multifaceted, offering new horizons in the diagnosis, treatment, and management of mental disorders. AI's integration into mental health services not only enhances clinical outcomes but also democratizes access to care, particularly for underserved populations worldwide. At the forefront of this transformation is the application of machine learning algorithms capable of analyzing vast datasets more efficiently than traditional methods. These algorithms facilitate the early detection of mental health issues by identifying patterns that may indicate a risk long before they become apparent through conventional diagnostic procedures. For instance, predictive analytics can analyze speech patterns and social media activity to detect early signs of depression or anxiety, enabling timely intervention. Moreover, AI-driven chatbots and virtual therapists are revolutionizing patient engagement by providing 24/7 support and personalized therapy sessions. These tools are particularly valuable in regions with a scarcity of mental health professionals. They offer cognitive behavioral therapy and other therapeutic techniques, which have been shown to be effective in managing conditions such as depression and anxiety. The anonymity provided by these platforms can also encourage individuals who might otherwise avoid seeking help due to stigma associated with mental illness. Another significant contribution of AI in this field is enhancing personalized treatment plans. By analyzing individual patient data over time, AI systems can tailor treatments based on the unique needs and response patterns of each patient. This approach not only improves the efficacy of treatments but also minimizes side effects by avoiding one-size-fits-all solutions. However, while AI presents remarkable opportunities for advancing mental health care, it also raises ethical concerns that must be carefully managed. Issues such as data privacy, consent for data use, and potential biases in AI algorithms are critical considerations that require ongoing dialogue among technologists, healthcare providers, policymakers, and patients themselves. In conclusion, as we continue to explore these innovative technologies, it is crucial to balance enthusiasm for their potential with vigilance about their implications. By fostering an inclusive conversation about both the promises and pitfalls of AI in mental health care, we can harness these tools responsibly to create a more accessible and effective healthcare system. 6.2 Encouraging ongoing dialogue among professionals. The integration of artificial intelligence, AI, in mental health care, while transformative, necessitates continuous and dynamic dialogue among professionals across various disciplines. This ongoing conversation is crucial for addressing the ethical, practical, and technological challenges that arise with the adoption of AI technologies in this sensitive field. Firstly, the interdisciplinary nature of AI in mental health requires regular interaction between technologists, healthcare providers, and policymakers. These dialogues help ensure that technological advancements align with clinical needs and ethical standards. For instance, discussions might focus on developing guidelines for the responsible use of AI-driven data analytics in diagnosing mental health conditions. By collaborating, professionals can create a balanced approach that leverages AI's capabilities while safeguarding patient privacy and autonomy. Moreover, these conversations are essential for staying abreast of rapid technological changes. Regular workshops, seminars, and conferences where professionals share insights and best practices can facilitate this. Such platforms not only foster knowledge exchange but also promote networking, which might lead to innovative cross-disciplinary collaborations. For example, a joint project between AI developers and clinical psychologists could lead to the development of more nuanced AI tools that better understand human emotions and cultural contexts. Another critical aspect of ongoing dialogue is addressing potential biases in AI algorithms used in mental health care. Continuous professional engagement helps identify and mitigate these biases, ensuring fair treatment across all patient demographics. Discussions could involve case studies where diverse teams retrospectively analyze AI's decision-making processes in clinical settings to detect any bias or error patterns. Lastly, maintaining an open channel among professionals encourages transparency regarding AI's limitations and failures alongside its successes. This honesty fosters trust among stakeholders, including patients, and paves the way for more informed consent processes as individuals better understand what to expect from AI-enhanced treatments. In conclusion, encouraging ongoing dialogue among professionals is not just beneficial but necessary for ethically navigating the complexities introduced by AI in mental health care. Such collaborative efforts will be pivotal in maximizing the potential benefits while minimizing risks associated with these technologies. 6.3 Reflecting on the intersection of technology and humanity. The intersection of technology and humanity, particularly in the realm of artificial intelligence, AI, in mental health care, presents a complex tapestry of challenges and opportunities. This convergence demands a nuanced understanding of both technological capabilities and human ethics, shaping how these tools are integrated into societal frameworks. One significant aspect is the ethical implications of AI in mental health. As AI systems become more adept at diagnosing and treating mental health issues, questions arise about the autonomy of AI decisions and the privacy of sensitive patient data. The potential for AI to make decisions without human oversight can lead to ethical dilemmas, especially if AI's decision-making process is opaque. Thus, it becomes crucial to develop transparent AI systems where the rationale behind decisions can be understood and scrutinized by human professionals. Moreover, the integration of AI into healthcare settings can alter the patient-care-provider relationship. The traditional empathetic interaction between patients and therapists could be supplemented or replaced by interactions with AI-driven interfaces. While this can increase accessibility to mental health resources, it also raises concerns about the loss of human touch in care provision. It is essential to strike a balance where technology enhances service delivery without compromising the quality of human interactions. Another critical area is addressing cultural sensitivity within AI algorithms. Mental health issues manifest differently across cultures, and thus AI systems used in diagnosis and treatment must be attuned to these nuances. This requires not only diverse datasets but also input from culturally diverse experts during the development phase of AI tools. In conclusion, as we navigate this intersection, continuous dialogue among technologists, healthcare providers, ethicists, and patients themselves becomes indispensable. Each stakeholder brings a unique perspective that can help shape an approach to AI in mental health that is ethical, effective, respectful of patient autonomy, and culturally sensitive. By fostering such multidisciplinary collaborations, we can harness the benefits of technology while safeguarding our fundamental human values. References: Davenport, T. and Calicotta, R. 2019. The Potential for Artificial Intelligence in Healthcare. Future Healthcare Journal, 6, 2, 94-98. Luxton, D. 2020. Artificial Intelligence in Behavioral and Mental Health Care. Academic Press. Vadium, A. N. Wisniewski, H. Halamka, J. D. Kashavan, M. S. and Taurus, J. B. 2019. Chatbots and Conversational Agents in Mental Health. A Review of the Psychiatric Landscape. Canadian Journal of Psychiatry, 64, 7, 456-464. Veal, M. and Binns, R. 2017. Fairer Machine Learning in the Real World. Mitigating Discrimination Without Collecting Sensitive Data. Big Data and Society.